Hi everyone, today I will go through how to take a history and how to write up notes without getting confused. Here is a brief and general format of a physiotherapy assessment. But how do I use it? For starters, always greet the patient. Saying things like, "How are you doing?" is acknowledging the patient is there and you are there to help. At this point, patients might start talking about their problems. But always go back to the problem they are coming in with. After greeting, always start with when and how did it happen. At this point, we can usually tell whether it is acute or chronic. We can know how long into the injury are we in. We can also know the mechanism of the injury. To understand more, we would like to know how does the pain come on. How is it restricting patients' movements, which further affects patients' daily activities. We would like to know the patient's current sin, how intense the pain, how often does it comes on and goes away, is the pain sharp or dull. Anything making the pain better? Anything making the pain worse? We need to take all those factors into consideration before making a hypothesis. That is your present condition section. After understanding the present condition, we have to look into the retrospect of things. Through past medical history, we are able to see whether there are any complications that will explain the symptoms currently, such as hypertension and COPD. We can understand why a patient might have high blood pressure or low oxygen concentration. We can also see whether past medical history is likely to remit and set expectation. For example, for people with stroke, without proper prevention and rehabilitation, it can be at risk of remitting. This is the first step to seeing the bigger picture. Second, the patient's social history is also a step into looking into the bigger picture. By asking what they like doing into their free time and the support system around them, we are able to figure out better exercises or better goals to get patients more involved. At the same time, we should be able to plan how others around the patient can help support him to complete their goals. Lastly, we can ask some special questions and red flags. For example, when suspected a meniscus tear, you can ask whether the patient's knee is clicking or locking. If yes, you can lean more into the patient having a meniscus tear. Screening for red flags is a must before any session. This is to protect you from legal troubles and ensure the patient is safe and receiving immediate treatment required. If you want to save time, separate the questions into upper limb and lower limb red flags. If it is an upper body issue, just limit the red flags questions targeting the upper body. At this point, you have gathered enough information to form a hypothesis. Before my testing, I usually have two differential diagnoses in mind to keep things going. So even if testing does not fit with the condition, having a backup theory to support the diagnosis keeps things going. Depending on the condition, a standard set of assessments can be made to tailor your patient group. Keep in mind that some of the assessments can also be a rehab for the patients. At this point you can complete a section of the SOAP notes format. In the assessment section, you should give a format as follows to keep it consistent. Please use this as a reference only. After that, treat the patient accordingly and make a realistic plan. And that's how you take a history.